I think one of the main goals of the centre, in keeping with the mission of tropical medicine generally, is to improve the health of indigenous populations, particularly those where diseases are most endemic and often the less privileged societies. And our research questions are very much rooted in that goal. We're working in a population in Kenya which has a high burden of bacterial and parasitic and viral diseases, with a very high child mortality. And even within the context of Kenya, the local population has a particularly high level of malnutrition, which is itself a risk factor for tuberculosis, and also HIV. So our goals to describe the burden of TB are very important for future public health policy decisions in terms of TB control within children, but also for coming up with a test which could be used in this low-resource setting. The benefits to patients which might arise out of our research are very clear to define. A new test which was more accurate and hopefully affordable and could be used at the point of care in a low-resource setting would transform the diagnosis of paediatric TB and have a major public health impact and an impact on the care and lives of children with tuberculosis. Our research is based at the Wellcome Trust Overseas Unit in Kilifi, Kenya, which is a collaboration between the Wellcome Trust and the Kenya Medical Research Institute in Kenya. And it's a privilege to work there because over the last approximately 15 years, a substantial scientific infrastructure has been built up in terms of an epidemiological demographic surveillance survey, a fantastic laboratory complex. But alongside that, the problems that we see in the district hospital in the community are very typical of other parts of rural Africa. So this combination of world-class facilities with developing world problems and the juxtaposition of the two provides a very exciting environment in which to answer some of critical questions in international public health.